If you look at transcriptional noise, for example, then chromatin modifiers, a great target set, right? So we are testing them and other people are testing them. So these things have been tested in cancers. It's not like something went through the clinical trials. This is still this idea of having a disease. We are a startup, and of course we are working with even Pharma these days on age-related diseases. And that lets us focus on aging without the necessity to bring indication to that. So in Jira, and I believe that in other companies, there is increasing possibility to fund studies that work on aging with the idea to show a large effect without bringing the indication. So if you ask me specifically, then chromatin modifying enzymes is a one great set of targets because lots of transcriptional noise comes from there.
Welcome to Longevity by Design, a podcast designed to give individuals access to the leading scientific information in the field of longevity. The ability to add years to your life and life to your years needs no opinion. Join us as we ask science to take the wheel. In each episode, Dr. Gil Blander joins a co-host and an industry expert in the field of longevity, shining a light and getting the answers to the key question: how can we live a longer, healthier life?
Hello, I'm Dr. Gil Blander. Welcome to Longevity by Design, how to live a longer, healthier life. We are produced by InsideTracker, your science-based guide to optimize your body from the inside out. Our guest today is Dr. Peter Fedichev. Peter Fedichev is a physicist-turned-biotech innovator and the founder and CEO of Gero, a company pioneering the use of AI and big data to understand and combat aging and complex diseases. Earning his PhD in theoretical physics from the University of Amsterdam, Fedichev built distinguished academic career with over 75 publications in the fields ranging from condensed matter physics and quantum mechanics to complex systems. His groundbreaking work applies principles of statistical physics to biology, revealing how subtle physiological fluctuation can indicate the pace of aging and vulnerability to disease. Recognized as a leader thinking and in the intersection of physics, biology, and biotechnology, he leveraged more than 20 years of expertise to develop models of biological age that are shaping both scientific research and practical health application. Welcome, Peter.
Well, thank you very much for having me with such an introduction.
No, you are welcome. And before we'll dive in, a quick reminder, if you are enjoying Longevity by Design, make sure to follow the podcast so you will never miss an episode. If you are listening on Apple Podcasts or Spotify, please leave us a review and rating. It's really helped more people discover the importance conversation. And of course, share this episode with anyone who's passionate about longevity and healthspan. So again, welcome, Peter. And I would like to start by talking about your journey and early career. Can you start by describing your early academic past in theoretical physics?
Well, that's been a long time ago already, but I think the sanitized version of that looks like I've been and it's factually I was interested in biology, I think, since my school time. Well, from my accent, I'm obviously Russian, and in Russia, as you know, there has been a great physics school. The biology school was also good, but maybe not so much. So at least I got some mentors early on in my life who suggested that young boy, there are people turned from physics to biology, but there are not so many cases in the opposite direction. So take what you can, like study physics. So I was encouraged actually to go to Moscow Institute of Physics and Technology, which is a Soviet-style MIT, Soviet version of that, where the level of physics was exceptionally good. So I graduated there. I developed interest in theoretical physics. And yes, I still believe that physics is science that has the best toolkit concerning complex systems. Physics explains most of the world we see around. I think the only few discrepancies that physics still observes are less than 1 in 10,000 discrepancies from the standard model. And maybe to loop it back to aging, as you know, in physics that is still called standard model, because we know that this is not a complete theory. And when you go to biology, we have, I don't know, hundreds theories of aging, and none of them cannot be a theory, right? So I think that physics is a great school. So I developed there. I did my PhD in the University of Amsterdam. Essentially, if I can look back, I mean, think about the beginning of 2000s. A young boy or whatever, student in physics could do either, I think, string theory, which is probably dead right now, plus 20 years from now, you could do quantum computing, which is probably not existing yet, plus 20 years from now. And at the same time, I think we see biology, and due to massive whatever demographic and other changes, I think biology is becoming the frontier of top science in the 21st century. And I think physics gives you some kind of unfair advantage when you look at complex systems like living systems. And I think switching to biology is just a great decision, not only for me back then, but I think for many people who are trained in physics now. I can possibly give you just one anecdote about that, is that later, when I was already kind of developing physicist, I talked to somebody who told me that, as you may know, physics developed mostly because of weapons. I mean, the history of 20th century is such that physicists earn their right to do whatever science they wanted by developing weapons. In 21st century, more money are going to drug design than to weapon production, which is quite remarkable. So that means, I think it's a sign, this is the indication where the complex engineering and great science is now laying. And that's why, once again, I believe that living systems are complex enough to benefit in their studying from physics. So I'm kind of proud of my decision.
Thank you for the great introduction. And what was the aha moment that sparked your transition into biology and aging research?
Well, I think it was gradual because, once again, I was doing this, what is called theoretical condensed metaphysics, and condensed metaphysics is roughly a science about exotic materials, superfluidity, superconductivity, all these interesting situations where complex systems exhibit properties that do not exist on the level of individual parts, right? Superfluidity is not a property of an individual atom, or superconductivity and things like that. This is a very rich field. It's about phase transitions. Synergetics is close to that. Very interesting field, which was kind of running out of problems. And I developed interest first to interactions of biological bodies in water, because, as you may know, water is a very interesting subject on its own. And I started talking to people who are applying this kind of physics and modeling to drug design first. And when I started asking myself what are interesting questions there, other than merely practical questions, that I quickly found a strange group of people who were thinking about aging. So I visited that SENSE event in Cambridge by Aubrey de Grey, for example. So I've met all those people. And then somebody showed me example of animals that presumably do not age, like naked mole rats, bats, and stuff. And that's where I got really fascinated, because I was doing physics in good schools, and of course the standards there were very high. So to get you interested, you really have to be shown something very interesting. And when I was a schoolboy, I knew that there are certain primitive creatures that do not age, like hydras and things like that. And for me, that was, of course, a miracle. But biology is full of miracles, right? It's a Kunstkamera of fancy objects. But why would I care? Because I'm kind of apex of creation. I'm a highly developed mammal. And who are those guys, right? It looks like this anthropocentric way of thinking, which I think prevented me and many other people at looking for that. By the end of 20th century, people like Finch started suspecting that there are mammals that are not aging. But as you may know, that takes impossible amount of time to prove. So in 2006, there was a paper by Buffenstein, who is now working in Calica, where there was the first proof that naked mole rats, mammals of the size of a mouse, that presumably do not show signs of aging. I mean, that's debated, but in biology you have very, very strong correlation. The larger you are, the longer you live. And when an animal of the size of a mouse doesn't want to die in 10 years, this is already something to consider. So I started thinking that if you can make a discovery of that scale in a field of science that was of interest, in the focus of human, I think, endeavor for the last 10,000 years, this is not a very well-developed field of science. I mean, no disrespect to people who are working there, but I think that was a good signal to switch. Once again, I was really impressed by the scale of the discovery of the low-hanging fruit, which was still there. And I got myself, let's say, a professional goal, or academic goal, is to figure out what's this difference between aging and no aging, if it already exists in nature.
No, thank you for that. And yeah, we interview Vera Gordinova, that I'm sure that you know her. I think that she discovered the aging phenomena of the naked mole rat, and definitely it's a very interesting creature. So continue getting back to your career path. What were the challenges and surprises in moving from physics to life science?
Well, there are many. I think, first of all, I think historically the most interesting science is done on the interaction between different fields. But at the same time, the standard academic path is not very suitable for developing interdisciplinary research. So it's very hard to do physics and then instead of keep doing exotic quantum matter for quantum computer, start thinking about interactions in water or then maybe aging or non-aging in animals. So maybe you can do it once you get tenure position where you get some kind of job security and you can start thinking broadly. But the current academic path is such that you have to work a lot in your specific field before you get there. So I think there is a little bit of a structural problem here. So essentially people who could make a difference are forced to take less riskier approaches simply for job security. But at the same time, I think we see an interesting development outside of science where you think now at the biggest problems that used to be attempted to be solved by science, nuclear fusion, for example, or space or quantum computing. You can see that artificial intelligence, for example, more often than not, in the last 10 years, these problems have been solved by startups, not necessarily by academic institutions. So I think the most ridiculous example, I think, is space, because, we're sufficiently old people now here to ask ourselves, what would you say that if somebody would tell you that a small company can work better than NASA? I mean, NASA was like golden standard of being cool. It was rocket science, right? So I think what you're asking is really like at the intersection of the trends. There is a structural crisis in a way in academia that is being aggravated in many ways. At the same time, due to this enormous wealth creation by tech companies, there is now an alternative path. If your invention is practical, I'm not talking about string theory, right? There still you are kind of in a desperate situation. But if your invention has a chance to be practical, there are now ways to fund it at levels that are competitive or even better than what you can get in academic labs. So I think, in the retrospect, it's hard to say, but I think I felt something like that. So I felt constrained a little bit by what I can. I felt what I'm kind of forced to do for my career. And it wasn't somewhat of a conflict between what I could do and what I wanted to do. And I saw in this startup ecosystem, I saw an alternative way to fund exceptional science. And that's what I tried to demonstrate.
Excellent. Yeah, and I like the example of space and what SpaceX have done comparing to, I don't know, NASA and Boeing and all the other. And basically, it's like, I think that there is another example of the sequencing of the genome, if you think about it, what a small startup have done versus the old NIH and what is the budget. So
Sure.
I think
Yeah,
that...
but still, I think even in your example, the project originated from the top-down centralized approach. Of course, it was solved by a tech, biotech, whatever company, but still the project was initiated in a standard way. I think SpaceX, some quantum computing operations, AI, OpenAI, this is really like an insult to the traditional system. And when you start seeing that not once, but multiple times, look how many fusion startups are now.
Yeah. So you believe that the innovation now will come more and more from a small startup and not from big academia like MIT and other places? That's your prediction?
Yeah, my prediction is exactly that, is that the venture capital actually, once developed, of course, it's hard to develop it, but there are certain countries where these ecosystems exist. And these ecosystems, I think, generate their capacity to innovate already in the third generation, somewhere. And once again, looking by AI and looking at fusion and space, I see really the situation where the standard centralized approaches are failing more often than not.
Yeah. No, I agree. And even when you look at pharma and biotech, you can see that most of the innovation right now coming from small startup that the big pharma are buying and then they are putting it into the pipeline, but they are not doing the innovation. They have the pipeline, go from phase 1 to phase 2 to phase 3, but they don't know how to innovate as good as
Yeah,
a
but
startup, I guess.
that's the sign of a developed market, by the way, because before that venture capital infrastructure was developed, pharma companies had to do everything from research to selling, and this is not very homogeneous activity. I can maybe once again loop it back to biology. I think there is a very interesting analogy here that is by Jeffrey West. There is a wonderful book which is called Scale, and in his book, he derives actually that's his scientific contribution. And by the way, Jeffrey West is a physicist who was doing high energy physics. I think will be most known actually for his work in biology. So this guy actually established that the larger you are, the less metabolism per mass you have. So larger organizations have less metabolism per head per head count of their people, and that's why they cannot compete. So if you have a small team that is focused, I mean, they are failing fast, but who cares? But the metabolism level in those teams is much higher. And I think this is a universal thing.
Yeah. So maybe if you can provide explanation of a system level view of aging, how do you see it? And how physics can help with that?
Yeah, well, first of all, this question once again amounts to trying to build a theory of aging, or I mean, whomever is trying to extract such an explanation. And as you know, the idea of theory is inflated in aging science a lot, right? So most of our theories, unfortunately, are not quantitative, so we cannot plug numbers and actually prove that one theory or the other theory is correct. So that gets me back maybe to one of your previous questions. What was the difference between physics and biology? So if you let me reflect on that before I will tell you what amounts to the theory of aging. To me, that look, I think, and also from the business perspective, it's important to understand that making a drug and making an airplane system is roughly the same level of funding that is required. At the same time, in order to build an airplane, you have to do lots of calculations. You cannot just say that, look, how this fancy airplane will work and most probably fly from here to the moon, and let's build it and see if it flies to the moon or not. In order to spend a few $1 billion for such an exercise, they will make you compute everything up to, I don't know, 20 kilograms of mass. You'll know precisely how expensive that would be to fly there and back, and what are the risks of coming back or not. So in biology, we don't have that level of understanding. And still, the unmet need is huge. I mean, people need drugs so hard that people are throwing billions and tens of billions of dollars to develop those drugs just to see if it works or not. So that, unfortunately, in my view, builds a culture where people are saying that, look, that thing changes up with age. Let's kill it. Most probably we will live longer. Okay, let's set up a company, reduce that, go to clinical trials. And okay, and then in a group 500 people, you see effect 0.5% with p-value 5%. Bingo, science translational medicine paper. We solved aging. So the problem here is that there is a difference between quantitative understanding, like aging is this, and quantitative understanding that if we hit this, we will get effect of that size. So that's why for every theory of aging, we have a working example of an intervention that has very small effect, and some of them even work in humans with a very small effect. But if you look very closely, those effects are, I mean, not impressive for pharma, for example, right? Because it's not like pharma is not interested in drugs against aging. Pharma is not interested in effect sizes. Just to set you the stage, I think, I mean, this year, maybe last year, we have the first working example of a drug that is probably extending human life, which are those GLP-1 molecules. As you may know, they were developed for diabetes, then against obesity, and then now we see that they reduce the risk of other diseases by something like 30%. 30% like sound a lot, but human chances to die double every 8 years, meaning that the effect of 30% will be eaten by aging in a few years, meaning that these drugs most probably extend life, but by a very small number. So diets and exercises most probably produce the same effect. So that gives you the size of the effect that was observed in humans with a drug that works. And the actual question now is whether we want to keep making drugs like this against specific diseases, or do we want to develop drugs that actually do something against aging, and what can be the maximum effect size that we can get with a specific technology. So the questions that we're trying to pose are those, is that what is aging, what are factors that modifying it, and what would be maximum effect. I'm not talking about achievable effect, right? But if your maximum effect is 5 years, then, I mean, you cannot beat it. I mean, at best, you will get 5 years. So the question is, what should we be focusing on in order to extend life by more than that? So let me just throw a few facts at you. So, let's briefly, please ask questions, because I will really try to kind of drive you to the conclusion right here. So this will be a manipulation experiment right now. But look, different people talk about different things with respect to aging. Some people are telling that aging is this exponential acceleration of your chances to die as we age. So mortality goes up and doubles every 8 years in humans. Even chances to die from accident go up and double every 8 years in humans, because the chance to get hit by a bus go up with age, because the situation awareness is a cognitive function, and the cognitive function is degraded as we age. So this is kind of one definition. And your theory of aging has to explain that. Then, of course, we know that as we age, we have more and more diseases. And those diseases actually shorten your life. The truth here is that diabetes, metabolic failure produces most of the lifespan reduction. So early diabetes reduces life by 6 years. All other diseases are a lot weaker. So, for example, if somebody would solve all cancers tomorrow, the life expectancy would be also on the increase by 3 years. So that tells you, I think, something very powerful. It means that, of course, if you have a great drug against diabetes like Ozempic, you can extend life. But this is still small. Look, even 6 years on top of 60, 80 years of life in civilized countries right now, this is not like a very dramatic effect, which means that even if you collect all diseases, and that's what the medicine is doing right now, we are still talking about effect of the order of 10 years or something. Now, the bad thing, that other than diseases, aging is also a functional decline. And all of these things are important. So if you look at people who are 90 years plus right now, technically they are very healthy. So if you compare them with people, with their peers who have died before the age of 90, these people don't have diseases. Diseases don't stick to them. They could have cancer, but cancer didn't kill them. Okay, these people are very robust. But the problem that if you look at them functionally at 90 years old, they are shadows of their former self. There are no people who are running marathons at 90. There are no people who play chess at the master level at 90. Even though, once again, they're exceptionally healthy. So if they go to a hospital, technically they don't have too many chronic diseases. That tells you that aging and diseases is a very different thing. So aging is that functional decline that causes diseases, and diseases is something that is built on top of that functional decline. So now think about most of the studies of aging right now. You have to have a disease. In order to fund a startup, you have to have a disease. You focus on diseases and you confine yourself in this 15 years span. So I'm sorry for this kind of long introduction, because I think all the words are important here. So what people understand as aging right now is what they call a squaring of the curve, right? To reducing the disease level, morbidity level, to make, as they say, increase quality of life, to make us die at zero medical costs at a certain age as responsible citizens. In fact, aging is actually that functional decline. Our cognitive function is going down. VO2 max, your ability to move, is going down. Kidney function is going down. So all things that make you work unrelated to diseases are going down as we age. And this is precisely aging. So what I would tell you is that almost no companies is working, and almost no companies are working on functional decline right now. So once we understood that aging and diseases in long-lived mammals like humans are decoupled, that functional decline is aging and diseases is just a consequence of that, we started looking at the available medical data in order to understand what is the reason of that functional decline. Because once again, if you can stop functional decline, you can live a lot. You wouldn't be immortal. So people, even if aging like functional decline were arrested at a certain age, like 30, 40 years, maybe post-reproduction, who knows what be the safety criteria of such a drug, but still people would die of diseases like whatever, diabetes, cancer, and everything else, but those diseases would not be age-dependent. And this is very powerful because,
So no, that was fascinating, and it's very, very good and refreshing view. And I agree with you. If you think about a startup or companies, all of them are, because of the FDA, they have to have a claim for a specific disease. So they cannot come and say, we are treating aging, because aging is not a disease. So it's in a way a chicken and the egg. And I like your view, and come and say, okay, aging is basically decline, and diseases are, if I said it correctly, if not, correct me if I'm wrong, but aging is basically decline, and diseases are the side effect of the decline. And
exactly.
As a Longevity by Design podcast listener, you understand the value of improving your health for today and for all the years ahead. And if you want to live your healthiest, longest life possible, you need to understand what's going on inside. At InsideTracker, we take a personalized approach to healthspan optimization that eliminates guesswork from your wellness plan. InsideTracker analyzes blood biomarker and DNA data, along with physiomarker data from fitness trackers like Oura Ring, to deliver personalized food, supplement, lifestyle, and exercise recommendations that allow you to take control and improve your health span. And for a limited time, Longevity by Design listeners can get 20% off at the InsideTracker store. So if you're ready to receive a personal health analysis and data-driven wellness plan to optimize your body for the long haul, then it's time to start inside. Visit InsideTracker.com/podcast to get started today. That's InsideTracker.com/podcast to get started today.
And you came with a term called resilience, and I assume that the 90 plus people that live to 90 and almost no disease. And by the way, my father is now 94, my mother is 91. And yeah, my mother had a couple of cancer and all of that. My father was never sick, but still they are fully functional. But definitely, as you said, my father cannot run a marathon. My mother cannot, they move and all of that, but they are, I would say that even the shrinking activity is maybe, 10, 20, 30% from the peak that they used to have in the past. So basically, we see the decline, and I heard you talking about resilience. So maybe you can try to couple all of it together and discuss resilience and how you measure it and what is measured and so on.
Exactly. So once again, the most important part is to understand that the decline is the causal mechanism that leads to all the other thing. And then, of course, the question is how to measure it. And for that, we're using massive amounts of human data, which is most important, must be longitudinal. Longitudinal means that you have multiple measurements from the same individual, because in such a way you can see trajectories of human health. Because if you look at a large data set where every person is measured only once, you have all those nice curves, like, average body mass is changing, whatever inflammation markers are changing and everything else. But I think if you call to your own intuition, for people who are here, once again, living long enough, they would understand that, for example, if they think about their body weight fluctuations, the body weight fluctuations occurred at a certain stationary level for a number of years. And then once in a while, those stationary levels were changing. As people grow, suddenly there are transitions, like at about 40 years old, for example, there is a transition where the body weight is going up in most people. And then no amount of exercise or dieting would be able to reduce it to the previous level. And what most important is that once you stop exercising or dieting, you would return to your new level, not the previous level. So it's really the human bodies, as these examples of complex systems, they evolve in a very complex trajectories, which are associated with these sudden shifts of the equilibrium positions. It's like earthquakes in your body, then your body rearranges to a novel position, and then to another novel position, and then to another.
Yeah, and by the way, Peter, I'm measuring my weight every day. So I have like a weighting scale. I don't know if you know this company, but it's a wireless scale, and every day I'm measuring it. And it's exactly like that. I have a small fluctuation, let's say between, pound to less than a pound every day. But once in a blue moon, I would say every 5 to 10 years, suddenly I get to a new set point, and then I stay there for another 5 to 10 years, and then you change it. Yeah.
Exactly. So what happens is that we are governed by very complex regulatory systems, and those regulatory systems have equilibrium points, and these equilibrium points shift, and essentially our aging, our life trajectory is the diffusion. We jump in between those semi-equilibrium points, and some of these jumps are associated with developing of chronic diseases. Some of them are just molecular level when you have mutations, epimutations, somewhere you don't register them in the body weight variation. But when the whole system of nutrient sensing is collapsing and going to another new unwanted equilibrium, you develop a metabolic disease and everything else. So this is very individual, because there are so many systems that can fail in different combinations. The specific pattern of failures and the time of failures is very specific to a particular individual. So that's why our weight and everything else trajectories are so different. But if you look at this at a larger scale, you see most of the time a stable dynamics, responses to stresses that bring you back to homeostatic equilibrium. And then you see the sequence of jumps. And by the way, this sequence of jumps is aging. And in every new position where you find yourself, you are a little bit crippled because these positions are deleterious, they are pathological. We are optimized for our young evolutionary. We are evolutionarily optimized for our young position. So what happens is that human body is too complex. We cannot control our position in this kind of medical variable space, and those jumps are diffusions. So these are these are responses to stress that were not checked, and this diffusion is aging. And our kind of development on top of that slow aging process is our body attempts to readjust to the increasingly pathological internal state. And the change of that pathological internal state, this sequence of jumps, is actually aging. So by looking at the data, you're able to develop this language. You can measure the position in terms of this jump space. You can also see the property of the body state fluctuations in every new position. So what you can see that all those positions are increasingly pathological, meaning that the time that is required to get back to the norm is actually increasing as you age. I mean, the more jumps you experienced, the more time it takes for you to recover. And then, of course, if it takes more time for you to recover, then you spend less and less time in the most healthy position, right? Because you're spending more and more time on recovering instead of operating in the fully functional state, which means that whichever stress is coming when you are not optimal, the more damage you acquire and the more unwanted jumps you experience. So that's exactly how aging occurs. And that's why, for example, why people are getting more vulnerable to diseases. I mean, at every point in time, we may be having about 1 million cancer cells in us. But when you are 30 years old, you don't care because your immune system has nothing else to do rather than taking out those cells. But when people are 60 or 80, the situation is different because, once again, the immune system is already crippled. Second, it's busy working on all the other crippled systems because our immune system is a wonderful garbage collector. And then if on top of that you still generate not 1 million, but maybe 5 million cancerous cells, that could be just a denial of service for this system. So that's precisely how this slow buildup of damage is translated to increased by the loss of resilience. It's translated to increased vulnerability, and then suddenly you skip a cancer cell here and there, skip an infection here and there, or you build up stuff in your vessels that essentially would kill you. So that's how it works. You jump in this highly complex configurational space, and you get crippled. And when you get crippled, the time your resilience is lost, you spend less and less time in your fully functional state. And having been increasingly less functional most of your time makes you vulnerable for further jumps. And these are chronic diseases or stresses or infections or cancer, doesn't matter what. And that's how you get all your other diseases going up with age.
And those, let me try to zoom in into those jumps, because it sounds like those jumps are the most important.
Yes.
You jump from
Yes, exactly.
very young to middle age, let's say, to old age. So those jumps are occurring due to, I assume, mutation in the DNA that basically enzyme or something else is suddenly not functional, or
that's very interesting, the question, because that's what we have seen just recently. So, well, think about it. We are highly evolutionary optimized beings, meaning that, of course, for almost every form of damage you can think of, there is a system that can counter it. And once again, most of human life on our planet was boring. I don't know, you can search in Google for boring billion years, for example, where life existed, but nothing happened. Nothing happened because we don't have fossils. But what happened is that life was optimizing molecular systems that allowed eventually life to become multicellular and everything else, meaning that we have lots and lots of repair systems that can get activated quickly and fix almost not every damage, but almost all the damage. I mean, that's how it works. The problem is that there is a difference between having ways to fix things and being able to deploy ways to fix things at the same time. So you can think about it like a fire brigade that has all the necessary equipment, but it has to operate in a city that at the same time fights crime or external invasion or something like that. So most of the time, aging is a result of not a functional incapacity but scheduling problem. And this is very clear when you see molecular level single cell data where you look at mutations, epimutations, and everything else. If you look at the rates of those mutations, all these jumps, and once again, these are not necessarily mutations in the DNA, it could be mutations, epimutations in chromatin, it could be changes in states of proteins. And there are so many ways that can go wrong and have to be fixed. You can start looking at the rates at which those errors propagate. And you would find that the distributions of those rates are very kind of mathematically familiar to people who study the reliability theory. You know that these rates, that there are lots of extremely rare events. I mean, what is lots? Of course, rare events means that they're rare, but you have 1 trillion cells, and rare events in 1 trillion cells are not that rare. And once again, we're complaining about aging, but we're living 100 years. And 100 years almost, and 100 years is a lot longer than any molecular scale. So in fact, we are very reliable machines. It's just we're not happy machines, but we're very reliable machines. So when you look at these things, at those jumps, you would find that in order to such jump to occur, you have to have multiple failures at the same time. It's like with airplanes. Airplanes are extremely reliable, but if you look at any story of air crash, you would find that the crash occurred because of a combination of multiple things that were not benign, but were not very dangerous on its own. So that's exactly how those jumps occur. So most of the time, these jumps are impossible because you have multiple level systems that are confronting those jumps. And that's why we're living 100 years. At the same time, on rare events, most of the time when there is some additional stress, right, and the pilot didn't sleep or something like that, just really yet another 15th thing that was highly exceptionally rare and most of the time was not dangerous. But when those 15 or 20 things come together, then all those evolutionary sophisticated systems fail to deploy at the right time. I mean, all of them are present, but they fail to deploy at the right time, and you trigger an exceptionally rare event that generates the jump. That's how these things work. So, for example, that's how cancer develops, right? Almost no mutation can kill you, but if 6 or 7 specific mutations co-occur in the same cell and your macrophages are sleeping at the same time, right? So I listed you this recipe for disaster. Then you suddenly get cancer, right? So that tells you a very interesting thing is that once again, we're so much reliable that these things are rare, but at the same time, we're sufficiently large that rare things times 1 trillion cells times 100 years give you 1. Right? We're talking about very rare things. And for those rare things to occur, you have to trigger multiple improbable events. And that tells you precisely that undoing those things is also very hard. Because to undo it, you have essentially to do a criminal investigation on what happened. Stop all of that, undo them one by one, and then restart the system from scratch. So that's very hard. I mean, that's what airplane industry is doing, but at the same time, we still see planes crashing. So I'm sorry for me be this kind of technical departure, but I think we have to give, what it's due to the efficiency of the system that already exists, and at the same time appreciate that most of the damage, most of the jumps that we see is a result of extremely bad combinations of rare events that mount as we live, more or less linearly, and they induce stress, pathological stress on all the other systems, essentially overriding them at some point at about maximum human lifespan at 120 or something. All of these systems, or at least the major systems in your body, would be incapacitated by the overall burden of those rare events. So, I mean, it's not a pleasant story to tell. I mean, that's how aging works.
Yeah, so if I'm trying to translate what you are saying to my language, what you are saying, there are a stochastic mutation in the body. And in a rare, unfortunate event, you have the airplane crash moment that you have a mutation in tumor suppressor and oncogene, and the immune system is not working, and more, and angiogenesis gene suddenly hyperactivated. And then
thousands of events at the same time.
And then suddenly, the cancer occurs. Or if you look at, diabetes, you have enough mutation.
Metabolic failure occurs. You just switch to another metabolic state, which is different from the optimal.
Yeah. So my follow-up question is, I assume that some of those events are, as you said, stochastic, and you need hundreds of them, or all of them, it's like that. But I assume that there is, or I hope that there is a master switch that you can deploy in order to prevent it. For example, if we look at cancer, now there is immunotherapy. And the immunotherapy, in a way, theoretically can treat all the cancer, because basically you train the immune cells to detect the antigen of the cancer. So do you believe that there is something like that, like master switch, that we can activate, and then we can prevent or delay, let's say delay, hopefully, but even better, completely prevent the decline and allow us theoretically to live forever? That's my question.
First of all, we started with these examples of mammals that don't want to age, or age slowly, or who cares, age one order of magnitude slower than their mass-matched peers, let's put it like that. So I like to point this example all the time, because we see that this probably works in nature. So the question is to figure out why. And when I'm talking about all these combinations of rare events, I think the common intuition would be that if you reduce the level of stochastic forces, so all unforeseen events, right? So the more disturbances on the flight, the lesser disturbances on the flight, the less is the probability of that perfect storm. So obviously in systems where there are lots of unpredictable fluctuations, these perfect storm situations occur more often. So if you think about this aging drift, the rate at which all those mutations and jumps accumulate, there should be parameter that is roughly the parameter that is telling you how much stochastic fluctuations are in the system, how many unforeseen events per unit time occur. And animals that have their operations running very smooth, they have less jumps. So the amount of jumps per unit of time should be related to fidelity of your molecular systems. And if you look at exceptionally long-lived mammals, you could see that these guys are producing proteins with almost no errors. They read DNA with almost no errors, right? So the error rate in their system is so small that the combinations of errors are even less frequent. So this is actually a good thing, because if in order to jump you have to get multiple rare events at the same time, if you reduce the frequency of rare events, the rate of the jumps should go down dramatically, right? So basically, if you ask, to translate that language of reliability theory to biology, it's like that common recommendation. If you want to live longer, you should have your good day schedule, right? You should have to go to bed and wake up at the same time. So, what intuitively that means is that you have to reduce the level of fluctuations. If you make your life predictable, your body can deploy whichever system is necessary to react on your night-day cycle. So what you can do at a larger scale is you have to look at systems that generate most of physiological noise. If you can dampen that noise, you should be able to reduce the rate of aging. So, for example, we have quite a lot of noise as mammals from our nutrient system, right? We have these glucose spikes. So we have more and more people who are wearing these glucose monitors right now and trying to look at glycemic index of their food. What these people are trying to do, they are damping the fluctuations in metabolic signaling in their body. So in a way, they are reducing what physicists would call the effective temperature associated with the nutrient sensing fluctuations. So they make their system more predictable, and then your body, in its infinite wisdom, would adjust to a more predictable situation with less error rate than to a less predictable situation. So what I think the coming wave of longevity biotech will be doing, I think, with kind of our pitch, look at the unpredictable part of the operation of human body to the fluctuations, and look for ways how to reduce the fluctuations, how to reduce unpredictability, and hence reduce the rate of aging by interventions that increase molecular fidelity, by reducing physiological noise. We believe that this is super possible to do, because assume you believe this. Of course, this has to be proven, right? But assume for the moment that you believe that this is a strong modifier of human aging. In that case, to screen for drugs against that and test for drugs against that would be super easy. So that's precisely where physics gets in. You asked me, look, you have all these bunch of rare events. They are kind of super unique, very different in every human. Is there any kind of master parameter that actually drives all of them? And yes, in physics, there is such a parameter. So if you look at the process like diffusion, and this really like all those jumps are like diffusion in physics. And diffusion is extremely temperature dependent. And what is temperature? Temperature is the level of uncontrolled fluctuations. It's a heat. unusable work, right? So if you can reduce something, is there something like temperature in living systems? Yes, it is, because, well, thermodynamics is a science that even doesn't care if atoms exist, and of course the bodies should work in such a way that temperature exists. And if you find it, you can actually show, and we have shown it recently, that such parameter exists and controls the rate of aging in humans and in dogs, and suddenly you have a way to test drugs against this. So it's like your glycemic control, but on steroids, not by yourself, but by the drugs.
Yeah, one question you discussed the glycemic control and the CGM, continuous glucose monitoring. So there is a theory in aging that called hormesis. So basically, you want to have some stress in order for the body to be ready. Because if you are unstressed all the time, at the end of the day, when stress will come, I don't know, the COVID will come or bacteria will come or something like that, you won't know what is that because you never faced it. And then the same with the controlling your peaks post meal peak of glucose. If you control it very well all the time, when you'll suddenly eat an ice cream or whatever, then your body won't know how to deal with that. Do you agree with that, or you think that no, it's
Yeah,
better to flatten?
no. I broadly agree, because I think it always comes like two ways, right? So people in the past most probably had very high levels of inflammation, because that was protecting us from highly non-sterile environment in our caves. Of course, now that inflammation kills us in the long run, but since the sanitation improved, we possibly don't need that level of inflammation anymore, right? So now we can possibly try drugs that reduce inflammation, and at least in animals, these drugs also extend life. So I think this is a double-edged sword, as usual. So the changes in the environment should go side by side with the changes in our physiology and medicine in order to generate lifespan extension. Of course, those fluctuations of physiological parameters, which we don't like right now since they're leading to our aging, were actually selected by evolution for certain purpose, right? And it could well be that if we reduce those fluctuations and then send us back into pristine, dangerous environments, we will be dying as flies. The situation is such that we are evolving on the top of the food chain in such a way that nobody can kill us. We make our second nature. And in that second nature, we don't need that level of fluctuations in our physiological parameters anymore. We can reduce them and extend life. But of course, if we go back to nature, we won't see dramatic life extension. I can also maybe comment about this idea with the stress, that look, the idea that almost any animal on Earth, or also plants who care, all living systems extend life in response to stresses, I think is very universal for a very simple reason, that if it takes multiple years for you to develop, then evolutionary, it's not a great idea to kill you whenever you get into a wrong ecological situation, when you have a famine or something like that. So almost all animals, complex animals, evolved in such a way that if you are in a dangerous situation, like you have stress, for example, you don't have enough food, you start repairing your genome and underinvest in reproduction in the hope that in a few years or months you will get back to a lot of food and reproduce. So this is a cheat code that nature uses in order to extend life by a little bit, by a year or so, but not by 10 years or by 100 years. Evolutionary, it doesn't make sense to extend life of individuals that cannot find food for 100 years. For most species at least. So that's why this works universally, and that's what we almost always do, like with training in the gym, for example, right? So we are forcing ourselves certain level of stress. This is healthy for us, but the effect of that is never large. So that's very important thing. I mean, we're using evolutionary developed ways to change our lifespan in response to stresses, and there was no evolutionary reason to make that effect strong.
And a follow-up question about model organisms. So most of the labs in aging research and actually in the academia, and also a lot of companies using mice as a model organism. Do you believe that that's the right model organism to study aging, or and if not, what is the better model organism?
Yeah. Well, I don't think it's the right mechanism. It's a very model organism. It's a very good model organism to study diseases, because these animals can develop diseases very quickly. So you can develop something that looks like diabetes in a few months, in mice on a high-fat diet. In humans, you can go to McDonald's for 50 years and with some unwanted body shape variations, you will be still reasonably healthy, at least one order of magnitude longer without that. So these animals live like 2 years. That's why it's very hard to learn from them how not to age. They should be learning from us how not to age. And the corollary to that is that if we find something that works in them, there is a high chance that if we port it back to humans, the effect will be very small. That's what we have seen, for example, with Novartis trials of analogs of rapamycin. They were able to register the effect on immune system aging, but the group size there was like 200 people. So if you need 200 people to register an effect, most probably the effect is there, but it's too small to be practical. So that's why they discontinued those trials. So I think that there is a dramatic transition in the aging regime between small animals and larger animals. So everything that is larger than a rat in mammals most probably ages slowly due to those jumps, rather than to that sepsis-like inflammation crisis like mice do. And that means that drugs that work well in mice would not work well in long-lived species, and the other way around. That also tells you that drugs that would work very well in humans would most probably not work well. I mean, they wouldn't do a lot to mice. The borderline is maybe dogs and cats. So now on the positive side. So we have seen lots of data from dogs. There will be a paper soon by us about dogs. We see that dogs age as humans. So dogs also age by those jumps. And that means that, and by the way, we also see that drugs that extend life in mice do not work very well in dogs. I mean, the effect is there, but it's very small. It's also very important that the effect is also transient. It's like with exercises. You stop exercising and the effect disappears pretty quickly, right? So dogs have all those features, meaning that we should be able to test good drugs against aging in humans in dogs. And this is, by the way, also a great go-to-market strategy.
Okay, so what you're saying, everyone right now, or not everyone, almost everyone is wrong that looking at aging in mice, because basically you look at disease. Mice is a good model for disease, but not for aging or longevity.
Exactly.
If you want to study aging or longevity, go to dog, cats, maybe monkeys, and the best is to do it on human, if you can.
Yes, eventually, yes, in humans. But look, if what we're telling you is correct, that mechanisms of aging are the same everywhere. But if you have a short-lived species, then these jumps do not contribute to aging. And even if you have a great drug there, you wouldn't see the effect on lifespan, right?
Yeah.
So, I mean, this is still not proven, right? I mean, this is a fancy theory. So the most important thing at this time is to prove that this is correct. And then, of course, you can do it either in humans or you can do it in dogs. And still in dogs, it would be faster for two reasons. First, dogs still age faster than humans. So the effect size would be larger there. So you need less time to do that. And second, in the US right now, there is a kind of regulatory going on in animals first. I think it will be somehow going to humans eventually too. So what they are telling you is that if you have reasonable expectation of efficacy, retrospective data suggesting that what you do is first safe and may work, does not work, but may work, you can have conditional approval in dogs. That's what Loyal has done for the IGF modulators. And then you go on the market. You build a large cohort, and this is very important in aging. And then the most important second reason, FDA lets you do clinical trials on aging in dogs, right? There is no aging as an indication in humans, but in dogs, they don't care. Because people will buy a drug against aging in dogs. And if it's safe, and if it may work, they will give you conditional approval. You can get a large cohort on dogs. And, when your effect is slow, when the aging is slow, but the signal to noise can be beaten with the group size, so you can get a larger cohort. You can still show that aging is reduced in those animals, and that would be the proof that whatever I'm telling you about aging is correct. If it's correct, I think there will be a way to put it into humans.
And in your opinion, what will be the first drug, or what in your opinion is a candidate drug for real aging and not disease, like what we discussed with GLP-1 or metformin or rapamycin? What is a real drug, and what is the mechanism? What would it do to our body in order for us to escape from or delay the aging significantly?
Well, still, maybe a beta Ozempic could get a few more years, but that would still not be a drug against aging. I think if you follow, there are multiple works, not only by us, suggesting that there is a stochastic component to biological age clock. So there is an increasing number of groups that are looking at stochasticity in human aging, and they attempt to do drugs that reduce the level of stochasticity in the hope to reduce the rate of aging. There is no drug that is approaching clinical trial right now, so all of them are in the animal studies right away. And I don't know, maybe in a year or two, we will report something, or maybe other people will report something. I think this is a very quickly developing subfield, which is awaiting. I mean, look, the first generation drugs that were essentially drugs against age-related diseases are now all in clinical trials. And if you look at companies like BioAge, they kind of mutated from aging to metabolic health for a reason, right? Because if you still want to have a disease, metabolic health is the largest leverage on human lifespan. So technically, metabolic health is aging 1.0. I also understand that there is now an increasing number of companies or people who understand that this is not enough. I mean, that's not what we wanted. And essentially, there are two large groups of people now. Some people say that let's try to do epigenetic rejuvenation, because this has, at least in theory, potential for a large effect. And I appreciate that. And then there is another group of people which we are trying to lead, is that instead let's look at fluctuations, because this is a way to bridge average lifespan to the maximum lifespan, and that's plus 40 years of life, and in theory at least. So I don't believe that epigenetic rejuvenation will work to a large effect. So I think it will produce the same effect as everything else, but that's my opinion. So it has to be tested in clinical trials. And what we're trying to build is possibly larger than that. But this will be kind of figured out, I think, in the next 5 years.
And what if you may, if it's okay for you to say, what will be the target for decreasing the stochastic effect? Is there a specific target, specific enzyme,
Yes.
or it's?
Yeah, of course. So if you look at transcriptional noise, for example, then chromatin modifiers are a great target set, right? So we are testing them, and other people are testing them. So these things have been tested in cancers. It's not like something went through the clinical trials. This is still this idea of having a disease. We are a startup, and of course we are working with even Pharma these days on age-related diseases, and that lets us focus on aging without necessity to bring indication to that. So in Jira, and I believe that in other companies, there is increasing possibility to fund studies that work on aging with the idea to show a large effect without bringing the indication. So if you ask me specifically, then chromatin modifying enzymes is a one great set of targets, because lots of transcriptional noise comes from there. And interestingly, at least in mammals, we see evidence that in the nutrient sensing system, there are enzymes that regulatory proteins that are not responsible for, let's say, glucose level, but they're responsible for the rate at which the glucose level is resilience, right? So it appears that nutrient sensing system is a source of a lot of noise in mammals, and drugs that are helping you to smooth the curve. Like that's why I brought this example for glucose continuous measurement system. That may be another interesting avenue to look at. So all of them have to be tested, of course, in trials, but I do believe that this idea of stochasticity, the idea of those jumps and processes that regulate the rate of those jumps, that as at the end of the day, as I said, is a scheduling problem. And the scheduling problem is always a problem of unpredictable events. So these are fluctuations. So everything that cools down your body and reduces the level of fluctuation will extend life. And we believe that this will be a very strong effect.
And how do you measure those jump or fluctuation? Do you have a specific biomarker, or you look at a lot of multi-biomarker and see that as you?
It's very easy. So once again, that's where physics comes in. So if you have a room and you have lots of molecules in that room, so if somebody remembers from school physics, then the average energy of those molecules will be the same. So they interact in such a complicated way that they equilibrate the energy between them. Meaning that if you can get, for example, single cell assay, and you can measure fluctuations of transcript levels or protein levels, you would find that doesn't matter. You can take certain bunch of things measure fluctuations there, or certain other bunch of things measure fluctuations there. There is a strong correlation between them. So there is this temperature-like parameter there, because all the fluctuations these systems interact so strongly that the fluctuations equally spread across many things. So you can go to clinical variables, measure fluctuations there, right? And then you can go to single cell level, measure there, you can correlate them. And if the correlation exists, you know that you measure them correctly, and then you can take a drug and give it even to a mouse for 1 month and see if the fluctuations are reduced. You back it up, both with single cell transcriptomics and with clinical data variation, and you prove that the drug reduces the fluctuations. So essentially, it's kind of two-piece problems, especially if we are thinking about testing these drugs, for example, in dogs. You go to good data sets with dogs, which we have access to. We look how those fluctuations affect their lifespan, right? So we have retrospective data saying that dogs that maintain their it's also resilience, right? So the better is your resilience, the better you maintain your fluctuations. So that's how these things are all related. So if we see the dogs that maintain their physiological levels better live longer, and then assume that you have a drug that helps even mice to maintain the level of physiological fluctuations better, there is a chance that those drugs will also extend life. And that's what we want to put into animals as a proof of concept.
So if I'm taking it to my world, just to be sure that I understood it well, what you are saying, let's look at the omic level. Let's look at thousands of expression or hundreds of thousands. And then see that the lower the fluctuation is better. And if you see a big fluctuation, that's basically a jump. And then you want to prove that, let's say, dog that have less fluctuation, it's also will live longer because there is
yes,
there are
and
less
that's what we have already. I mean, retrospectively, we have already established that. But of course, who cares about? I mean, retrospectively, this is not yet a proof. So the only proof is the prospective clinical trial. But at least retrospectively, this is established. We have already some preprints, and there will be more preprints this year. So we're really looking into dogs because, first we see the signal there, and second, we believe that you can put experimental drugs into large cohorts there a lot faster. And what most important is that you can have a direct measurement either on incidence of diseases or to lifespan.
Yeah, no, that's fascinating. It's a very refreshing approach that you're taking, and also it's you're taking much bigger risk than coming and saying, okay, let's look at metformin or rapamycin that everyone is looking at. You're looking at it in a completely different way, which is very exciting. And unfortunately, we don't have a lot of more time to talk. So I have a few more quick questions that I would like to ask you.
Sure.
What is your personal approach to health and longevity? What do you do in order to live better, longer today before the new drug that you're developing will come?
Well, usual stuff that I think everyone knows. I'm old enough to start controlling what I'm eating because my body weight is not as well controlled as it was before. So you have to do lots of exercise. So I'm higher on proteins, a lot more on exercises than I used to be when I was younger right now. So I'm technically I'm in a better shape physically now than I was even 20 years ago, but that's because I'm exercising more. So it's not because of my normal levels. It's kind of my, increased level. So yeah, I think diet and exercise is still the largest modifier. I'm very sensitive to sleep, but it's more like pain rather than desire to live longer. So if I don't sleep, I don't feel well. So look, it means that I'm doing standard stuff essentially. And what I also think people underestimate, if you look at the data, that we look a lot, that's always scary, is that if you take out the effect of smoking, and I think we don't even need to discuss it anymore. So if you take out the effect of diets, then the largest modifier of human health is social status, which is of course not the amount of money that you have. It's something more subtle. Most probably this is mental health. So feeling of purpose, mental health, healthy social interactions and everything else, this is super important because to look at the example of Churchill, the guy was starting his day from heavy drink, right? And he was kind of functional alcoholic. So, just think about this example as an example of sense of purpose beating essentially everything else. And what is important also is that the effects of unhealthy lifestyles are amplified in people with low social status, which is once again for me not the amount of money but the mental health. So essentially, a wrong head can kill a good body. So that's an underestimated factor of longevity.
That's a great advice. And the last question that I have to you is, do you have any advice for young scientists that entering the longevity field? What would you recommend them to do?
Well, that's always scary. First of all, it means that you're old. If people start asking these questions, I like to show. I like the example of Richard Feynman. He was answering that way. Don't ask me, because all the problems that you could solve with things that I learned are already solved by me. Meaning that you have to be solving something else. No, look, I think that there is no way to avoid math if you are going to modern biology, because I think 20 years ago, biology was for those people who were afraid of mathematics. This doesn't work anymore. There is no way to avoid data science and AI. So I think that, I would actually advise people who are already in the math and in physics to go to biology, because, as I said, that gives you an unfair advantage in many ways. And for those people who like biology, I would really advise to get harder on exact sciences. I think it's always a synthesis, and biology is on the cusp of transformation into engineering science, in my view. So as a high-level advice, I would actually advise everyone to go to biotech and biology, because I think this will be a place of enormous value creation, place to satisfy ambitions, scientific ambition. That's the best science of the coming 50 years, I believe.
Yeah, I completely agree with you. And just for our audience, again, if you enjoyed today's conversation, please follow Longevity by Design, leave us a rating and review, and share this episode with a friend or colleague who passionate about longevity. And Peter, that was a fascinating discussion. I really liked it. And I think that our audience will like it. And it's a refreshing view of longevity that I interviewed almost 100 scientists, and that was really refreshing and different. So thank you so much for
I hope
doing
it was
that.
not too technical. Thank you very much.
At least not for me, and I hope that not for our audience. So thank you so much for that, and I hope that your approach will succeed, because it sounds like your approach is more transformational than as you said, the other. And I agree with you. Rapamycin or metformin might give us another half year or year. You can do that today with changing your nutrition and exercise and social interaction. We are looking now for the game changer, and hopefully what you're doing is a game changer. So I appreciate it and very excited about it. And thank you so much. And
thank you very much.
And I hope that we will talk again in the future. Thank you.
Yeah, thank you very much. Thank you.
Thanks for listening to Longevity by Design. Please subscribe to this podcast on Apple, Spotify, or YouTube. Longevity by Design is powered by InsideTracker, a personalized health optimization platform that helps people improve their lives by improving their bodies from the inside out, using personalized, science-backed recommendations for nutrition, supplements, and lifestyle changes. To learn more, visit InsideTracker.com/podcast.